So basically, preventing the cancer cervix prevention is done at three levels. The primary prevention, where we want to prevent an HPV infection at all. Okay. So then there is the management here is twofold. One, that they would promote good sexual practices. So basically, behavioral modification. The other, which has now come up, is the prophylactic vaccines. Okay. Then comes the secondary prevention कि अब infection तो हो गया है, but at least we pick up the precancerous lesions and treat them. Then is the tertiary prevention from mortality, so treatment of the precancerous and the invasive cancer lesions. Why, Pratmesh has asked, why screening with cytology at 21 but HPV at 30? That's yes, yeah, because HPV, many of these people will clear HPV infections. We said ना कि HPV जो है वो sensitive तो है ना, बट स्पेसिफिक नहीं है, क्योंकि बहुत सारे पेशेंट्स ने HPV इन्फेक्शन क्लियर ही कर लेना है बाय 30 years of age. It is not going to persist. It is only the persistent HPV infection which we are worried about. So that is why अगर 30 के नीचे हम HPV करने लगेंगे तो सबके ही आते जाएगा पॉजिटिव. So that is why it is not done before 30. We would have talked about it later, but since you have asked it, I'll tell. ठीक है. So if at all you have to do something at age of 21, you can go for cytology. If you are very worried that this patient had, especially in the sex workers and those class abused patients who have been abused, in those class our HIV also 25 पे हम शुरू कर ले advise कर देते हैं, because they are at a relatively higher risk. But HPV is not recommended before 30 because a lot of people will clear out those HPV infections. So those we need not to worry about. ठीक है. Otherwise हम तब से HPV कर लेंगे तो फिर आगे over treatment and triaging हो जाएगी. HPV, yeah, HPV detection will be earlier. This was not from the slide that I showed. This is showing the timeline of how the HPV infection finally leads to CA cervix, not the timeline in age of the patient. Okay. So first step is definitely HPV infection, but anybody who has a sexual debut before 30 years may get infected with HPV, but a patient with a normal immune system is likely to clear it by 30 years. तो जो 30 के बाद persist होते हैं, those are the ones which we are worried about. ठीक है. तो इसलिए हम less than 30 पे HPV नहीं करते हैं.